Okay, let's dive right into this. In this explainer, we're going to unpack one of the most dynamic, transformative, and, let's be honest, kind of complex periods of human growth, the school-age years, specifically spanning ages 6 to 12. If you're studying nursing, child psychology, or you just really want a deep, structured understanding of pediatric development, well, you are absolutely in the right place. We've got a lot of dense, multifaceted ground to cover today, but don't worry, we're going to break it all down step by step. Here's a quick roadmap of what we're covering. First, an overview of school-age children. Second, play, peers, and development. Third, safety and latchkey kids. Fourth, health and sex education. And finally, the Knowledge Q&A challenge. Definitely take active notes as we go because that challenge at the end is going to test exactly what you've picked up today. All right, starting off with Section 1, Overview of School-Age Children, the Big Picture. To really understand a child between 6 and 12, which, can sometimes feel like managing pure, unfiltered chaos, we have to anchor their everyday behavior to some specific developmental frameworks established by leading psychologists. First up is Jean Piaget. He defines this period as the stage of concrete operations, and this brilliantly illustrates a massive cognitive shift. See, during the preschool years, kids are highly egocentric, right? They view the world entirely from their own perspective. But during these school-age years, that egocentric view gets replaced. They develop logical thinking. They actually begin to grasp cause and effect. And most importantly, they start to see things from another person's point of view. They finally understand that their actions have real, concrete consequences in the physical and social world around them. Then we've got Erik Erikson, who refers to this as the stage of industry. This is a phase defined by a massive thirst for knowledge, accomplishment, and mastering new activities. Kids at this age desperately want to be productive. They want to build things, join groups, and get really good at their hobbies. Now, successful adaptation here builds a deep, lasting sense of self-esteem, but it's a double-edged sword. If they face constant failure, or if they're hit with unrealistic expectations without any support, it leads directly to a lingering sense of inferiority. Let's move to Section 2 and see how this builds into play, peers, and development. So this internal drive for industry doesn't just happen in a vacuum. It happens on the playground, in the classroom, and out on the sports field. Mastering the skills of a team sport, like basketball, for example, is a perfect real-world manifestation of Erikson's stage of industry. Through organized play, children aren't just, burning off energy. They are actively developing physical skills, learning the actual mechanics of teamwork, and experiencing the satisfaction of true accomplishment. Play essentially enables the child to feel powerful and in control of their environment. But we have to realize the difference between a 6-year-old and a 12-year-old is staggering. It's like night and day. There is a massive cognitive and social jump during this window. At ages 6 to 7, a child has a vocabulary of about 2,500 words. They're learning basic rules, but they can be pretty verbally aggressive, bossy, and downright argumentative. Now, jump to ages 11 and 12. They're beginning to play with abstract ideas. Their focus has shifted dramatically outward, which is characterized by intense team loyalty and a profound commitment to their peer group, often prioritizing their friends over their family for the very first time. Moving right along to Section 3, Safety and Latchkey Kids. As children spend more time navigating the world without direct adult supervision, the practical safety measures parents put in place become absolutely critical. In the U.S., a lot of school-age children are what we call latchkey children, meaning they're left unsupervised after school because their parents are working. If a child is going to be home alone, they need incredibly clear, structured rules that function like a practical checklist. Teach them. Never enter the house if the door is ajar. Never admit a stranger. Don't display house keys outwardly where people can see them. And ensure they know exactly how and when to dial 911. Ambiguity is literally the enemy of safety at this age. Now, accidents do happen, especially with the high physical activity levels of this age group. So the crucial point is this specific emergency tip. If a permanent tooth is accidentally knocked out, an avulsed tooth, it should be picked up strictly by the crown to avoid damaging the root area and immediately placed in milk until the child reaches a dentist. Jot this down in your notes, guys, because it might just be a massive hint for our upcoming challenge. All right, jumping into Section 4, Health and Sex Education. The physical changes during these years happen incredibly fast, and health maintenance really requires a proactive approach from caregivers. One of the major health challenges we see is the prevention of childhood obesity. The actionable, step-by-step advice for parents starts with simply using appropriate serving sizes for their age and strictly limiting those empty calories from juice and soda. Another really simple nutritional switch, replacing whole milk with skim milk. But beyond just diet, it's about movement. It's about encouraging active family times rather than just defaulting to sedentary screen time on the couch. Another big aspect of health is the environment, and that includes our pets. While pet ownership is fantastic for fostering trust, empathy, and responsibility, which feeds right back into Erickson's industry stage, by the way, there are real biological risks. For example, reptiles can transmit salmonella, and cats can transmit toxoplasmosis. The key takeaway here is that for immunocompromised children, certain pets like turtles or reptiles are simply not recommended because the risk of pathogen transmission is just too high. And as pre-adolescence approaches, sex education becomes absolutely essential. The foundational principles start with recognizing that this is a lifelong process. It is not a one-time awkward sit-down conversation. Questions should be answered simply, exactly at the child's level of understanding. It is also vital to use correct anatomical names for genitalia, rather than leaning on slang. And above all, rely on factual knowledge. Kids at this age need clear, honest reassurance about their changing bodies, and using fear-based scare tactics is not only ineffective, it's genuinely harmful to their psychological development. And now for Section 5, what we've been building up to, the Knowledge Q&A Challenge. All right, you've absorbed the psychological frameworks, the safety rules, and the health guidelines. These upcoming questions are modeled directly after real clinical and NCLEX-style scenarios to test your retention of the overview we just explored together. Let's see how well you've been tracking. Here's our first challenge scenario. While playing in school, a 9-year-old child suffers an injury that knocks his tooth out. What should the school nurse do? Take a quick mental beat. Think back to that specific emergency tip we covered just a few minutes ago. And the answer is, place the tooth in a cup of milk and call the parent to take the child to the dentist. If you remembered that, excellent job. Milk actually helps preserve the delicate root cells of the avulsed tooth way better than water or wrapping it in a dry cloth, which massively increases the chances the dentist can successfully reimplant it. Okay, let's look at question 2, drawing from the health section. The parent of an 8-year-old child seeks advice from the nurse because her child is overweight. What would the nurse advise the parent to do? Think about the actionable guidelines for preventing obesity we discussed, but also think about what a school-age child developmentally craves. The absolute best advice here is to include the child in meal planning and preparation. The clinical rationale for this is brilliant because it hits 2 targets at once. Yes, it teaches healthy habits, but psychologically, it aligns perfectly with Erickson's stage of industry. By giving an 8-year-old an active role in the kitchen, you give them a sense of accomplishment and control over their environment, rather than just imposing restrictive diets from the top down. Finally, our third scenario, a real test of handling psychosocial development. A 9-year-old practicing the piano gets frustrated and pounds the keys. What is the best response to the child? Should you scold them? Tell them piano lessons cost good money? Let's look at the optimal approach. That piece sounds hard. I can see how you could be discouraged. Now, what's really interesting about the psychology behind this response is that mutual respect involves actually accepting the child's feelings. At this stage of concrete operations and industry, the child is acutely aware of their failures. By acknowledging their frustration directly, you validate their experience without judging it, which actually helps them process the emotion and return to the task at hand. So we've covered the cognitive leaps, the drive for industry, the crucial safety rules, and health maintenance. I want to leave you with this final thought to chew on. How do we balance giving children the independence they crave with the structured safety they still deeply need? It is the ultimate tightrope walk of the school-age years. Mastering that balance is the key to raising confident, capable adolescents. Thank you so much for joining me for this explainer, and keep that curiosity alive as you continue your developmental studies.